Question 1. Operational review demonstrates that a patient recovering from a stroke, who is participating in a physical therapy regimen to regain mobility in their affected arm, expresses a strong desire to immediately use a specific electronic device that requires fine motor skills and sustained upper extremity use, which is currently contraindicated by the therapy team due to the risk of overexertion and potential re-injury. The rehabilitation registered nurse is faced with managing this patient's immediate desire versus the established therapeutic plan. Which of the following approaches best aligns with the principles of rehabilitation nursing and patient-centered care? Option A. Firmly deny the patient's request, stating that it is against medical orders and that they must adhere strictly to the prescribed therapy without further discussion. Option B. Immediately allow the patient to use the electronic device as requested to satisfy their immediate desire and avoid conflict, assuming the patient understands their own limitations. Option C. Engage the patient in a discussion about their desire, explain the rationale behind the current therapy plan and its importance for long-term recovery, and explore alternative therapeutic ways to address their need for engagement or distraction that are consistent with their current functional abilities. Option D. Escalate the request to the entire interdisciplinary team for immediate discussion and decision-making, bypassing any initial attempt by the nurse to address the patient's concerns directly. Correct answer is C. Engage the patient in a discussion about their desire, explain the rationale behind the current therapy plan and its importance for long-term recovery, and explore alternative therapeutic ways to address their need for engagement or distraction that are consistent with their current functional abilities. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the rehabilitation registered nurse to balance the immediate needs and preferences of the patient with the broader goals of the interdisciplinary rehabilitation team and the established care plan. The patient's desire for immediate gratification conflicts with the long-term functional gains that are the cornerstone of rehabilitation nursing. Navigating this requires strong communication, patient advocacy, and an understanding of the principles of patient-centered care within a structured therapeutic framework. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient autonomy while ensuring adherence to the established rehabilitation plan. By engaging the patient in a discussion about the rationale behind the plan and exploring alternative therapeutic ways to address their immediate desire, the nurse upholds the ethical principle of beneficence, acting in the patient's best interest, and respects the patient's right to self-determination. This collaborative approach fosters trust and empowers the patient to participate actively in their recovery, which is crucial for successful rehabilitation outcomes. This aligns with the core tenets of rehabilitation nursing, which emphasize maximizing functional independence and quality of life through individualized, patient-centered care. Incorrect approaches analysis. One incorrect approach involves immediately acceding to the patient's request without considering the impact on the rehabilitation goals. This fails to uphold the nurse's professional responsibility to provide evidence-based care and to advocate for the patient's long-term well-being. It could lead to setbacks in therapy, increased risk of injury, and a missed opportunity to educate the patient on safe and effective coping strategies. Ethically, this approach could be seen as a failure of non-maleficence, do no harm, if the requested activity poses a risk to the patient's recovery. Another incorrect approach is to dismiss the patient's request outright without explanation or exploration of alternatives. This demonstrates a lack of empathy and can damage the therapeutic relationship, leading to patient frustration and noncompliance. It fails to acknowledge the patient's emotional state and their need for comfort or distraction, which are important aspects of holistic rehabilitation. This approach neglects the principle of respect for persons and can undermine the collaborative nature of rehabilitation. A third incorrect approach might be to involve the entire interdisciplinary team immediately for a minor request, without attempting initial de-escalation or problem-solving at the nursing level. While team collaboration is vital, unnecessary escalation can be inefficient and may not empower the nurse to utilize their skills in patient communication and therapeutic intervention. It also risks undermining the nurse's role in managing day-to-day patient needs and building rapport. Professional reasoning. Professionals should employ a decision-making process that begins with active listening and empathetic understanding of the patient's expressed need. This is followed by an assessment of the request's alignment with the established care plan and potential risks or benefits. The next step involves clear, patient-centered communication, explaining the rationale behind the care plan and exploring therapeutic alternatives that can meet the patient's underlying need without compromising rehabilitation goals. If the request remains a significant barrier or involves complex ethical considerations, then appropriate consultation with the interdisciplinary team is warranted. This process prioritizes patient safety, promotes autonomy, and ensures adherence to professional standards of care. Question 2. Assessment of a rehabilitation registered nurse's strategy for facilitating effective interdisciplinary team collaboration in a complex patient case involving significant functional deficits and multiple comorbidities, where initial communication has been fragmented, leading to potential discrepancies in care planning. Which approach best promotes a cohesive and patient-centered rehabilitation plan? Option A. Convening a structured interdisciplinary team meeting with all relevant members, including the patient and/or family, to openly discuss progress, challenges, and revise goals collaboratively. Option B. Focusing on documenting each discipline's individual progress notes without actively seeking collaborative discussion. Option C. Relying on the physician to synthesize all information and communicate the final care plan to the rest of the team. Option D. Individually contacting each team member to gather their input and then compiling a summary for review. The correct answer is A. Convening a structured interdisciplinary team meeting with all relevant members, including the patient and/or family, to openly discuss progress, challenges, and revise goals collaboratively. Explanation. The scenario presents a common challenge in rehabilitation settings, ensuring effective communication and coordinated care among diverse interdisciplinary team members, each with their own expertise and perspectives. The professional challenge lies in navigating potential communication breakdowns, differing priorities, and the need to synthesize information to create a cohesive and patient-centered plan. Careful judgment is required to identify the most effective strategy for fostering collaboration and achieving optimal patient outcomes, adhering to professional standards and ethical obligations. The correct approach represents best professional practice because it prioritizes direct, open, and respectful communication among all team members. This aligns with the ethical principles of beneficence and non-maleficence by ensuring that all relevant information is shared and considered, leading to a more comprehensive and effective care plan. Furthermore, it upholds the principle of patient autonomy by ensuring the patient's goals and preferences are central to the team's discussions and decisions. Regulatory frameworks for nursing practice, such as those governing scope of practice and interprofessional collaboration, emphasize the importance of clear communication and teamwork to ensure patient safety and quality of care. This approach fosters a shared understanding and commitment to the patient's rehabilitation journey. An incorrect approach that relies solely on the physician to disseminate information fails to leverage the unique contributions of other team members, potentially leading to incomplete assessments and plans. This can violate the ethical duty to provide comprehensive care and may contravene regulations that mandate interdisciplinary communication for patient well-being. Another incorrect approach that involves bypassing direct team communication and addressing concerns individually with each member, without a facilitated group discussion, risks misinterpretation, fragmented information, and a lack of cohesive strategy. This can lead to inefficiencies and potentially compromise patient care, which is contrary to professional standards and ethical obligations. An approach that focuses on documenting individual contributions without actively seeking collaborative input neglects the core principle of interdisciplinary teamwork, potentially leading to a disjointed care plan and failing to meet the holistic needs of the patient, which is a deviation from best practices and ethical mandates for coordinated care. Professionals should employ a decision-making framework that begins with identifying the core problem or need for collaboration. This involves recognizing the value of each team member's perspective and the necessity of shared decision-making. The process should then involve actively seeking opportunities for structured interdisciplinary communication, such as team meetings or case conferences, where all members can contribute and discuss patient progress, challenges, and goals. This framework emphasizes active listening, respectful dialogue, and a commitment to finding common ground for the patient's benefit, ensuring adherence to ethical principles and regulatory requirements for collaborative practice. Question 3. Comparative studies suggest that while standardized cognitive screening tools are valuable, their effectiveness in capturing the nuances of post-stroke cognitive and psychological deficits can be limited by factors such as patient fatigue, anxiety, and the specific nature of the neurological injury. Considering this, which of the following approaches best reflects best professional practice for a certified rehabilitation registered nurse conducting an initial cognitive and psychological assessment for a patient recovering from a moderate ischemic stroke? Option A. Focus exclusively on the patient's physical rehabilitation needs, assuming that cognitive and psychological issues will resolve spontaneously as their physical function improves. Option B. Utilize a combination of standardized cognitive screening tools, patient self-report questionnaires regarding mood and anxiety, and direct observation of the patient's performance on functional tasks relevant to their daily living, while also seeking input from family members regarding observed changes in behavior and cognition. Option C. Rely primarily on the patient's verbal assurances that they are feeling fine and thinking clearly, without employing any formal assessment tools to avoid causing them distress. Option D. Administer a single, widely recognized cognitive screening tool and base the initial care plan solely on the resulting score, assuming it accurately reflects the patient's overall functional capacity. The correct answer is D. Administer a single, widely recognized cognitive screening tool and base the initial care plan solely on the resulting score, assuming it accurately reflects the patient's overall functional capacity. Explanation. This scenario presents a professional challenge due to the inherent subjectivity and potential for bias in cognitive and psychological assessments, particularly when dealing with individuals who have experienced significant trauma or neurological changes. The rehabilitation registered nurse must navigate the complexities of accurately capturing a patient's functional status while respecting their dignity and autonomy. The challenge lies in selecting assessment tools and methods that are both reliable and valid for the specific patient population and their presenting issues, while also adhering to established professional standards and ethical guidelines. The correct approach represents best professional practice because it prioritizes a comprehensive, multimodal assessment that integrates objective measures with subjective patient reports and collateral information. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, ensuring that interventions are based on a thorough understanding of the patient's cognitive and psychological state. Furthermore, it upholds the professional standard of providing patient-centered care, recognizing the patient as the primary source of information about their experiences and functional limitations. Adherence to the certified rehabilitation registered nurse scope of practice, which emphasizes evidence-based assessment and intervention, is also critical. An incorrect approach that relies solely on a single, standardized cognitive screening tool without considering the patient's individual context or potential for fatigue or anxiety fails to capture the full spectrum of cognitive function. This could lead to an inaccurate diagnosis or an inappropriate treatment plan, potentially causing harm by overlooking significant deficits or overestimating capabilities. Ethically, this approach violates the principle of justice by not providing equitable assessment tailored to the individual's needs. It also falls short of the professional obligation to use the most appropriate and validated tools for the specific clinical situation. Another incorrect approach that involves interpreting assessment results through a lens of personal assumptions or stereotypes, rather than objective data and established diagnostic criteria, constitutes a significant ethical failure. This introduces bias and prejudice into the assessment process, undermining the patient's trust and potentially leading to discriminatory care. Such an approach violates the professional duty to maintain objectivity and impartiality, and it directly contravenes the ethical imperative to treat all patients with respect and dignity, regardless of their background or condition. A further incorrect approach that neglects to involve the patient or their family/caregivers in the assessment process, or fails to explain the purpose and limitations of the assessments, is professionally unsound. This undermines patient autonomy and the right to informed consent. Ethically, it breaches the principle of respect for persons by not actively engaging the patient in decisions about their care and by failing to provide them with the necessary information to understand their own health status. Professional decision-making in cognitive and psychological assessment requires a systematic process. First, identifying the specific clinical questions to be answered. Second, selecting assessment tools that are appropriate for the patient's age, cultural background, and suspected condition. Third, administering assessments in a standardized and sensitive manner. Fourth, interpreting results within the broader clinical context, considering all available information. And finally, using the assessment findings to inform a collaborative and individualized care plan. Question 4. Governance review demonstrates a need to enhance the evaluation of pain management strategies for patients undergoing rehabilitation. Considering a patient experiencing moderate to severe postoperative pain following a total knee replacement, which of the following approaches best reflects current best practices and regulatory expectations for registered nurses in the U.S.? Option A. Prioritize a multimodal approach that combines scheduled non-opioid analgesics, judicious use of short-acting opioids as needed for breakthrough pain, and the incorporation of non-pharmacological interventions such as ice, elevation, and guided imagery, with ongoing assessment of pain intensity and functional improvement. Option B. Administer opioid analgesics on a fixed schedule to ensure consistent pain relief, and only consider non-pharmacological methods if the patient expresses dissatisfaction with the current medication regimen. Option C. Focus primarily on aggressive pharmacological management with long-acting opioids to achieve complete pain elimination, deferring non-pharmacological interventions until the patient is closer to discharge. Option D. Rely solely on patient-reported pain scores to guide medication adjustments, without considering the patient's functional status, potential for side effects, or the availability of alternative pain relief modalities. The correct answer is A. Prioritize a multimodal approach that combines scheduled non-opioid analgesics, judicious use of short-acting opioids as needed for breakthrough pain, and the incorporation of non-pharmacological interventions such as ice, elevation, and guided imagery, with ongoing assessment of pain intensity and functional improvement. Explanation. Scenario analysis. This scenario presents a common challenge in rehabilitation nursing, balancing effective pain management with the potential for adverse effects and the patient's overall functional goals. The challenge lies in individualizing care, considering the patient's unique pain experience, comorbidities, and response to interventions, while adhering to evidence-based practices and regulatory guidelines for safe medication administration and patient advocacy. Correct approach analysis. The correct approach emphasizes a multimodal, individualized pain management plan that integrates pharmacological and non-pharmacological strategies. This aligns with best practices in pain management, which advocate for a comprehensive assessment and a tailored approach to address the biopsychosocial aspects of pain. Regulatory frameworks for nursing practice, such as those outlined by the American Nurses Association (ANA), standards of practice, emphasize patient assessment, diagnosis, outcome identification, planning, implementation, and evaluation. Specifically, the implementation phase includes using appropriate interventions, which in pain management encompasses a range of therapies. Ethically, this approach upholds the principle of beneficence by actively seeking to alleviate suffering and promote well-being, while respecting patient autonomy by involving them in treatment decisions. Incorrect approach is analysis. One incorrect approach might focus solely on pharmacological interventions without adequate consideration for non-pharmacological adjuncts or patient preferences. This could lead to over-reliance on medications, increasing the risk of side effects, tolerance, and potential for dependence, which may not be in the patient's best interest and could violate the principle of non-maleficence. It also fails to fully address the complex nature of pain. Another incorrect approach might dismiss the patient's reported pain level due to a perceived lack of objective findings or a history of challenging pain presentations. This disregards the subjective nature of pain and the nurse's ethical and professional responsibility to advocate for the patient and believe their report. Such an approach could violate the patient's right to adequate pain relief and potentially lead to undertreatment, causing unnecessary suffering. A third incorrect approach might involve implementing a standardized pain management protocol without individualizing it to the patient's specific needs, comorbidities, and response to therapy. While protocols provide a framework, rigid adherence without adaptation can be detrimental, failing to account for individual variations in metabolism, pain perception, and potential drug interactions. This can lead to ineffective pain control or adverse events, contravening the principles of individualized care and patient safety. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough and ongoing assessment of the patient's pain, including its intensity, location, quality, and impact on function. This assessment should be followed by the development of a collaborative, individualized pain management plan that incorporates evidence-based pharmacological and non-pharmacological interventions. Regular evaluation of the plan's effectiveness and the patient's response is crucial, with adjustments made as needed. This process is guided by professional standards of practice, ethical principles, and regulatory requirements for safe and effective patient care. Question 5. To address the challenge of a patient recovering from a stroke who expresses frustration about not being able to attend family gatherings and participate in their gardening club, which of the following approaches best reflects the application of the International Classification of Functioning, Disability, and Health (ICF) to guide rehabilitation planning? Option A. Focus on educating the patient about the long-term effects of stroke and managing expectations regarding their ability to return to previous hobbies. Option B. Develop a physical therapy plan focused solely on improving upper extremity strength and fine motor skills to enhance dexterity for gardening tasks. Option C. Implement a speech therapy program to improve the patient's ability to articulate their feelings of frustration and sadness related to their limitations. Option D. Prioritize interventions that address the patient's social isolation and identify specific environmental modifications and personal strategies to facilitate attendance at family events and the gardening club. The correct answer is B. Develop a physical therapy plan focused solely on improving upper extremity strength and fine motor skills to enhance dexterity for gardening tasks. Explanation. Scenario analysis. This scenario presents a common challenge in rehabilitation nursing where a patient's progress is not solely defined by physical recovery, but also by their engagement in meaningful life roles and participation in their community. The complexity arises from the need to move beyond a purely biomedical model of care to a biopsychosocial spiritual framework, as advocated by the ICF. Accurately assessing and addressing these broader aspects requires a nuanced understanding of the ICF's domains and their interconnectedness, ensuring that care plans are holistic and patient-centered. Correct approach analysis. The correct approach aligns with the core principles of the ICF by focusing on the patient's activities and participation domains, alongside their body functions and structures. This approach recognizes that disability is not just a health condition, but an interaction between the health condition and contextual factors, environmental and personal. By identifying specific barriers to community reintegration and developing targeted interventions, the nurse is promoting the patient's ability to engage in life situations and achieve their personal goals, which is the ultimate aim of rehabilitation and a direct application of ICF principles. This is best professional practice as it moves beyond symptom management to functional restoration and improved quality of life, adhering to ethical obligations of beneficence and patient autonomy. Incorrect approaches analysis. One incorrect approach might focus exclusively on improving the patient's physical strength and endurance, without considering how these improvements translate to real-world activities or their desire to participate in social events. This approach fails to fully utilize the ICF framework by neglecting the activities and participation components, thus limiting the scope of rehabilitation and potentially overlooking crucial psychosocial barriers. It represents a failure to adopt a holistic view of the patient's functioning. Another incorrect approach could involve solely relying on the patient's self-report of feeling better, without objective assessment of functional gains or exploration of their participation in desired life roles. While subjective experience is important, it does not capture the full picture of functioning as defined by the ICF. This approach risks misinterpreting subjective well-being as equivalent to functional improvement and participation, potentially leading to an incomplete or inaccurate care plan. It may also fail to identify environmental or personal factors that are hindering participation, despite perceived subjective improvement. A third incorrect approach might be to document the patient's health condition and impairments without exploring the impact of these on their daily life activities or their engagement with their environment. This approach is essentially a pre-ICF model of care, focusing only on the body functions and structures, aspect, and ignoring the crucial interactional nature of disability. It fails to capture the contextual factors and the lived experience of the patient, thus not providing a comprehensive understanding of their disability and its impact on their life. Professional reasoning. Professionals should employ a decision-making process that begins with a thorough understanding of the patient's health condition and its impact on body functions and structures. Subsequently, they must explore how these impairments affect the patient's ability to perform daily activities domain, and their engagement in life situations and social roles, participation domain. This exploration should involve active listening, observation, and the use of standardized assessment tools where appropriate. Crucially, environmental and personal factors that may act as barriers or facilitators to functioning must be identified. The care plan should then be collaboratively developed with the patient, setting realistic, functional goals that address all relevant ICF domains and promote meaningful participation in life. Question 6. The efficiency study reveals a significant increase in patient falls within the rehabilitation unit, prompting a review of current fall prevention protocols. Which of the following actions best addresses this issue while adhering to ethical and legal standards for rehabilitation nursing? Option A. Immediately implement a policy requiring the use of physical restraints for all patients identified as having a high fall risk, regardless of individual assessment. Option B. Reduce the frequency of supervised patient ambulation for all individuals in the unit to minimize opportunities for falls. Option C. Increase the number of nursing staff on duty per shift without investigating the specific reasons for the fall increase. Option D. Conduct a multidisciplinary root cause analysis of recent falls, reviewing patient records, environmental factors, and staff observations to identify contributing elements and inform targeted interventions. The correct answer is D. Conduct a multidisciplinary root cause analysis of recent falls, reviewing patient records, environmental factors, and staff observations to identify contributing elements and inform targeted interventions. Explanation. The efficiency study reveals a significant increase in patient falls within the rehabilitation unit. This scenario is professionally challenging because it directly impacts patient safety and well-being, requiring a nuanced approach that balances efficiency goals with the ethical and legal obligations of rehabilitation nursing. The core conflict lies in identifying the root cause of the falls without compromising patient care or violating patient rights. Careful judgment is required to ensure that any implemented solutions are evidence-based, patient-centered, and compliant with relevant regulations. The correct approach represents best professional practice because it prioritizes a thorough, interdisciplinary investigation into the falls. This involves reviewing patient records, assessing environmental factors, and collaborating with the healthcare team to identify contributing causes. Such an approach aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Legally, it upholds the nurse's duty of care and the facility's responsibility to provide a safe environment, as mandated by regulations such as the Nurse Practice Act and facility policies that are in line with federal healthcare standards. This systematic review ensures that interventions are targeted and effective, ultimately reducing the risk of future falls and protecting patients. An incorrect approach that focuses solely on increasing staff-to-patient ratios without a comprehensive assessment is professionally unacceptable. This fails to address potential underlying issues such as inadequate training, environmental hazards, or specific patient needs, leading to a potentially inefficient allocation of resources and not solving the core problem. It may also inadvertently create new ethical challenges if it leads to staff burnout or dissatisfaction without demonstrable improvement in patient outcomes. Another incorrect approach that involves implementing a blanket policy of physical restraints for all patients deemed at high risk for falls is ethically and legally flawed. This violates the principle of patient autonomy and the right to freedom from unnecessary restraint. Federal regulations and ethical guidelines strongly advocate for least restrictive interventions. The use of restraints can lead to physical harm, psychological distress, and legal repercussions for the facility and the nursing staff. A third incorrect approach that involves reducing the frequency of patient ambulation to minimize fall risk is also professionally unacceptable. While seemingly intuitive, this strategy can negatively impact patient recovery, leading to deconditioning, muscle atrophy, and prolonged rehabilitation. It contradicts the fundamental goals of rehabilitation nursing, which aim to restore function and independence. This approach fails to consider the individual patient's capabilities and the benefits of appropriate mobility. The professional decision-making process for similar situations should involve a structured approach. 1. Identify the problem and its potential impact on patient safety and care. 2. Gather comprehensive data through observation, patient assessment, and team consultation. 3. Analyze the data to determine the root causes, considering both systemic and individual factors. 4. Consult relevant ethical codes, professional standards, and legal regulations. 5. Develop and implement evidence-based interventions that are patient-centered and least restrictive. 6. Continuously monitor the effectiveness of interventions and make adjustments as needed. 7. Document all assessments, interventions, and outcomes thoroughly. Question 7. The performance metrics show a variance in patient outcomes related to functional independence post-discharge. As a certified rehabilitation registered nurse, you are tasked with reviewing historical approaches to rehabilitation nursing to inform current practice improvements. Which of the following perspectives best reflects the evolution of rehabilitation nursing towards current best practices? Option A. Focusing on the historical development of rehabilitation as primarily a physical therapy intervention, with nursing's role being largely supportive and secondary to the physician's directive. Option B. Emphasizing the historical dominance of the medical model, where the primary goal was to manage symptoms and prevent further deterioration, with limited focus on patient participation in recovery. Option C. Acknowledging the historical shift from a purely medical model focused on disease cure to a biopsychosocial model emphasizing holistic patient well-being, functional restoration, and patient empowerment. Option D. Highlighting the early stages of rehabilitation nursing, characterized by a custodial approach focused on basic care and comfort, with minimal emphasis on active patient engagement or functional goals. The correct answer is C. Acknowledging the historical shift from a purely medical model focused on disease cure to a biopsychosocial model emphasizing holistic patient well-being, functional restoration, and patient empowerment. Explanation. This scenario is professionally challenging because it requires a rehabilitation registered nurse to critically evaluate historical approaches to patient care against current evidence-based practices and regulatory expectations. The nurse must discern which historical perspectives are foundational to modern rehabilitation nursing and which represent outdated or potentially harmful methodologies. Careful judgment is required to avoid perpetuating past errors while still acknowledging the evolution of the profession. The correct approach represents best professional practice because it demonstrates an understanding of the historical trajectory of rehabilitation nursing, recognizing how societal views on disability and medical advancements have shaped current care models. This understanding allows the nurse to contextualize contemporary practices, identify areas for continued improvement, and advocate for patient-centered care that aligns with current regulatory frameworks, such as those governing patient rights, evidence-based practice, and interdisciplinary collaboration. Adherence to these principles ensures that care is safe, effective, and ethically sound, reflecting the standards expected of a certified rehabilitation registered nurse. An incorrect approach that focuses solely on the medical model of rehabilitation, viewing the patient primarily as a collection of impairments to be fixed, fails to acknowledge the holistic and psychosocial aspects of recovery that are central to modern rehabilitation nursing. This overlooks the ethical imperative to treat the individual, not just the condition, and may violate regulations emphasizing patient autonomy and quality of life. Another incorrect approach that prioritizes custodial care over active participation and functional improvement reflects an outdated understanding of rehabilitation's goals. This can lead to patient deconditioning, reduced independence, and a failure to meet regulatory standards for promoting optimal patient outcomes. A third incorrect approach that dismisses the importance of patient and family education as a secondary component, rather than a core element of rehabilitation, neglects a crucial aspect of empowering individuals and their support systems for long-term success, potentially contravening guidelines on patient advocacy and self-management. Professionals should employ a decision-making framework that begins with identifying the core question or problem. Next, they should gather relevant information, drawing upon current evidence-based literature, professional standards, and regulatory guidelines. This information should then be analyzed through the lens of historical context, understanding how past practices have informed present approaches. Finally, The professional should synthesize this understanding to make a judgment that aligns with current best practices, ethical principles, and regulatory requirements, always prioritizing patient well-being and optimal outcomes. Question 8. The efficiency study reveals that a rehabilitation unit is experiencing varying levels of patient engagement and functional improvement across different patient populations. The nursing leadership is considering adopting a singular theoretical framework to guide all rehabilitation nursing interventions. Which of the following approaches, when applied by a certified rehabilitation registered nurse, CRRN, best reflects current best practices in rehabilitation nursing and aligns with regulatory expectations for comprehensive patient care? Option A. Solely focusing on a medical model that emphasizes the diagnosis and treatment of specific impairments and diseases, with interventions primarily determined by the healthcare team. Option B. Prioritizing a biopsychosocial model that integrates the impact of biological factors, psychological states, and social determinants on an individual's functioning and disability, while actively involving the patient in goal setting and intervention planning. Option C. Adopting a purely social model that attributes all disability to societal barriers and discrimination, with interventions focused exclusively on advocacy and systemic change. Option D. Implementing a charity model that views individuals with disabilities as recipients of care and assistance, with interventions aimed at providing basic support and comfort. The correct answer is B. Prioritizing a biopsychosocial model that integrates the impact of biological factors, psychological states, and social determinants on an individual's functioning and disability, while actively involving the patient in goal setting and intervention planning. Explanation. This scenario presents a professional challenge because rehabilitation nursing often involves navigating diverse patient perspectives on disability and functioning, which can be influenced by various theoretical models. A certified rehabilitation registered nurse, CRRN, must be adept at identifying and applying the most appropriate model to guide care planning and intervention, ensuring patient-centered outcomes aligned with regulatory standards for rehabilitation services. The challenge lies in selecting a model that not only reflects the current understanding of disability, but also supports the patient's goals and promotes optimal functional recovery within the scope of practice. The correct approach represents best professional practice because it acknowledges the evolution of disability models from a purely medical perspective to a more biopsychosocial and rights-based understanding. By prioritizing a model that emphasizes environmental factors, social participation, and individual agency, the CRRN aligns with current ethical guidelines and regulatory frameworks that promote patient autonomy and inclusion. This approach fosters a holistic view of the patient, moving beyond a deficit-based model to one that focuses on strengths, capabilities, and the removal of societal barriers to participation. This aligns with the principles of person-centered care mandated by rehabilitation standards, ensuring that interventions are tailored to the individual's unique context and aspirations. An incorrect approach that relies solely on a medical model of disability would fail to address the psychosocial and environmental determinants of functioning. This approach is ethically problematic as it may lead to interventions that are overly focused on treating impairments without adequately considering the patient's lived experience, social support systems, or environmental barriers. This can result in suboptimal outcomes and a failure to promote full participation in life activities, potentially violating the ethical obligation to provide comprehensive and individualized care. Furthermore, regulatory bodies often emphasize a holistic approach to rehabilitation that extends beyond medical management. Another incorrect approach might be to adopt a purely social model without acknowledging the impact of individual impairments. While the social model is crucial for understanding societal barriers, a rehabilitation nurse must also address the individual's physical, cognitive, or emotional challenges. Neglecting the individual's specific functional limitations could lead to interventions that are not sufficiently targeted or effective in promoting personal recovery and independence. This can also be seen as a failure to provide appropriate and evidence-based rehabilitation care. The professional decision-making process for similar situations should involve a thorough assessment of the patient's individual circumstances, including their impairments, functional limitations, personal goals, cultural background, and environmental context. The CRRN should then critically evaluate different models of disability and functioning to determine which best informs the development of a person-centered care plan. This involves considering how each model influences the identification of needs, the setting of goals, and the selection of interventions. Collaboration with the patient, their family, and the interdisciplinary team is paramount in this process to ensure that the chosen model supports the patient's journey towards optimal functioning and quality of life, in compliance with all applicable regulations. Question 9. Consider a scenario where a certified rehabilitation registered nurse is caring for a patient recovering from a stroke. The patient has undergone physical therapy for gait training and occupational therapy for fine motor skills. The nurse observes that the patient is experiencing significant anxiety about returning home and is struggling with meal preparation due to residual weakness. Which of the following best defines the scope of the rehabilitation nurse's role in this situation, encompassing the holistic definition of rehabilitation nursing? Option A. The rehabilitation nurse's role is limited to documenting the progress made in physical and occupational therapy sessions, as these are the primary disciplines responsible for functional recovery. Option B. The rehabilitation nurse's role is to primarily administer prescribed medications and monitor vital signs, as these are the core medical interventions for stroke recovery. Option C. The rehabilitation nurse's role extends beyond specific therapeutic modalities to include assessing the patient's psychosocial well-being, providing education on adaptive strategies for meal preparation, and advocating for appropriate home support services to promote independence and address anxiety. Option D. The rehabilitation nurse's role is to ensure the patient adheres to the prescribed exercise regimen, as this is the most critical factor in regaining mobility after a stroke. The correct answer is B. The rehabilitation nurse's role is to primarily administer prescribed medications and monitor vital signs, as these are the core medical interventions for stroke recovery. Explanation: this scenario presents a professional challenge because it requires the rehabilitation registered nurse to differentiate between the broad scope of rehabilitation nursing and the more specialized focus of a particular therapy. The core of rehabilitation nursing is holistic, encompassing the patient's physical, psychological, social, and vocational needs to promote optimal functioning and independence. This involves a wide range of interventions, including direct care, education, advocacy, and coordination of services. The correct approach represents best professional practice because it aligns with the definition and scope of rehabilitation nursing as established by professional organizations and regulatory bodies governing nursing practice in the United States. Rehabilitation nursing is not limited to a single modality, but rather integrates various aspects of patient care to achieve rehabilitation goals. This approach recognizes the nurse's central role in patient assessment, care planning, implementation, and evaluation across the continuum of care, empowering the patient and their family. An incorrect approach that focuses solely on a specific therapeutic technique, such as only administering prescribed medications or performing range-of-motion exercises without considering the broader psychosocial or functional implications, fails to encompass the full scope of rehabilitation nursing. This represents a regulatory and ethical failure by neglecting the holistic and patient-centered nature of rehabilitation care. Another incorrect approach that limits the nurse's role to that of a task doer, without engaging in patient education, advocacy, or interdisciplinary collaboration, also falls short. This is a failure to uphold the professional responsibilities inherent in rehabilitation nursing, which demand active participation in empowering patients and facilitating their return to the highest possible level of function and quality of life. The professional decision-making process for similar situations involves a thorough understanding of the patient's overall rehabilitation goals, the nurse's scope of practice as defined by state nurse practice acts and professional standards, and the principles of patient-centered care. It requires the nurse to critically analyze the patient's needs, identify appropriate nursing interventions that address the whole person, and collaborate effectively with the interdisciplinary team to ensure comprehensive and coordinated care. Question 10. The investigation demonstrates that a certified rehabilitation registered nurse is caring for a patient who has made significant functional gains, but expresses a strong desire to discontinue physical and occupational therapy, stating they feel like they've done enough. The nurse observes that the patient still exhibits some limitations in mobility and self-care tasks that could be further improved with continued therapy. As indicated by objective assessment data, The patient's family is present and appears supportive of the patient's wishes. What is the most appropriate course of action for the certified rehabilitation registered nurse in this situation? Option A. Immediately document the patient's refusal of further therapy and discharge them from the rehabilitation program as per their stated wishes. Option B. Persuade the patient to continue therapy by emphasizing the importance of achieving all possible functional goals, regardless of their current feelings. Option C. Initiate a comprehensive reevaluation of the patient's current functional status. Engage in a detailed discussion with the patient and family about the benefits of continued therapy and the potential consequences of early termination, and consult with the interdisciplinary team to collaboratively determine the best path forward. Option D. Inform the patient that their insurance will no longer cover therapy if they refuse, and suggest they reconsider their decision. The correct answer is C. Initiate a comprehensive reevaluation of the patient's current functional status. Engage in a detailed discussion with the patient and family about the benefits of continued therapy and the potential consequences of early termination, and consult with the interdisciplinary team to collaboratively determine the best path forward. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Rehabilitation Registered Nurse, CRRN, to balance the patient's immediate needs and preferences with the long-term goals of rehabilitation and the professional judgment of the interdisciplinary team. The patient's expressed desire to discontinue therapy, despite objective evidence of continued need and potential for further functional improvement, creates a conflict that demands careful ethical and clinical consideration. The CRRN must navigate the patient's autonomy while upholding their professional responsibility to promote optimal recovery and prevent potential harm from premature cessation of care. Correct approach analysis. The correct approach, which involves a comprehensive reevaluation of the patient's functional status, a collaborative discussion with the patient and family about the rationale for continued therapy, and consultation with the interdisciplinary team, represents best professional practice. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and respect for autonomy, acknowledging the patient's right to make decisions, even if those decisions are not what the clinician would choose. Specifically, under the regulatory framework for CRRN in the U.S., this approach adheres to standards of care that mandate thorough patient assessment, individualized care planning, and effective communication. It also reflects the ethical guidelines of nursing practice, which emphasize patient-centered care and shared decision-making. The CRRN role is to educate, advocate, and facilitate informed consent, ensuring the patient understands the implications of their choices. Incorrect approaches analysis. One incorrect approach would be to immediately cease therapy based solely on the patient's verbal request. This fails to uphold the CRRN professional responsibility to advocate for the patient's well-being and to ensure that decisions about care are informed and evidence-based. Ethically, this could be seen as a failure of beneficence and potentially abandonment of professional duty. Regulatory frameworks would likely deem this a deviation from the standard of care, as it bypasses essential assessment and communication steps. Another incorrect approach would be to dismiss the patient's concerns and forcefully insist on continued therapy without further discussion or reevaluation. This disregards the principle of patient autonomy and can erode trust within the therapeutic relationship. It may also lead to patient noncompliance and a negative perception of the rehabilitation process. From a regulatory and ethical standpoint, this approach fails to engage in shared decision-making and can be perceived as paternalistic, undermining the patient's right to self-determination. A third incorrect approach might involve documenting the patient's refusal without exploring the underlying reasons or offering alternative solutions. While documentation is crucial, it should be the outcome of a thorough process, not a substitute for it. This approach neglects the opportunity to identify barriers to participation, such as pain, depression, or lack of understanding, which could be addressed to improve engagement. It fails to meet the professional obligation to explore all avenues to support the patient's rehabilitation journey. Professional reasoning. Professionals should employ a decision-making process that prioritizes a thorough, ongoing assessment of the patient's condition and response to treatment. This involves active listening to the patient's concerns, exploring the reasons behind their expressed desires, and engaging in open, honest communication. Collaboration with the interdisciplinary team is paramount to ensure a holistic understanding of the patient's situation and to develop a unified plan of care. When patient preferences conflict with recommended interventions, the professional's role is to educate, advocate, and facilitate informed decision-making, respecting the patient's autonomy while ensuring they understand the potential consequences of their choices. This process is guided by ethical principles and regulatory standards that mandate patient-centered, evidence-based, and collaborative care. Question 11. Upon reviewing a patient's progress in a post-stroke rehabilitation program, the registered nurse observes that the patient expresses a strong desire to return to their previous high-demand occupation immediately, despite objective assessments indicating significant limitations in fine motor skills and endurance. The nurse has developed a care plan with more modest, achievable short-term goals focused on improving daily living activities and gradually increasing stamina. How should the nurse proceed with goal setting and care planning in this situation? Option A. Immediately adjust the care plan to prioritize the patient's stated occupational goal, even if it means setting highly ambitious and potentially unachievable targets to ensure patient satisfaction. Option B. Delegate the discussion about occupational goals to a physical therapist without direct involvement in the initial goal-setting conversation, as they have more specialized expertise in functional recovery. Option C. Engage the patient in a detailed discussion about the current care plan, explaining the rationale behind the proposed short-term goals, exploring potential strategies to address their desire to return to work in the future, and collaboratively revising the plan to incorporate realistic steps towards their ultimate aspiration. Option D. Inform the patient that their desired occupational goal is unrealistic at this time, and proceed with implementing the care plan as initially developed, focusing solely on the objective clinical findings. The correct answer is C. Engage the patient in a detailed discussion about the current care plan, explaining the rationale behind the proposed short-term goals, exploring potential strategies to address their desire to return to work in the future, and collaboratively revising the plan to incorporate realistic steps towards their ultimate aspiration. Explanation. Scenario analysis. This scenario presents a common challenge in rehabilitation nursing, balancing patient autonomy with the nurse's professional judgment and regulatory obligations. The patient's expressed desire for a specific outcome, while understandable, may not align with the most evidence-based or achievable rehabilitation goals, potentially impacting the effectiveness of the care plan and the patient's overall recovery trajectory. Navigating this requires sensitivity, clear communication, and adherence to professional standards. Correct approach analysis. The correct approach prioritizes a collaborative and informed goal-setting process. This aligns with the ethical principles of patient-centered care and shared decision-making, which are fundamental in rehabilitation nursing. By actively involving the patient in discussing the rationale behind the proposed goals, exploring alternative strategies, and documenting the shared understanding, the nurse upholds the patient's right to self-determination while ensuring the care plan is realistic, evidence-based, and aligned with regulatory expectations for comprehensive patient care planning. This approach fosters trust and promotes patient engagement, which are critical for successful rehabilitation outcomes. Incorrect approaches analysis. One incorrect approach involves unilaterally imposing the nurse's preferred goals without thorough discussion or consideration of the patient's perspective. This violates the ethical principle of autonomy and can lead to patient dissatisfaction, non-adherence to the care plan, and a breakdown in the therapeutic relationship. It also fails to meet regulatory requirements for individualized and patient-centered care planning. Another incorrect approach is to simply agree to the patient's stated goal without assessing its feasibility or potential risks. This demonstrates a lack of professional judgment and could lead to an ineffective or even harmful care plan. Rehabilitation nurses have a responsibility to apply their expertise to ensure goals are safe, achievable, and contribute to meaningful functional improvement, as mandated by professional standards and regulatory oversight. A third incorrect approach is to dismiss the patient's input entirely, focusing solely on objective clinical data. While objective data is crucial, ignoring the patient's subjective experience and aspirations can undermine motivation and engagement. Effective rehabilitation requires a holistic view that integrates clinical findings with the patient's personal values and desires. Professional reasoning. Professionals should approach goal setting by first establishing rapport and actively listening to the patient's desires and concerns. This should be followed by a thorough assessment of the patient's current functional status, prognosis, and potential barriers to achieving their goals. Open and honest communication is paramount, where the nurse explains the rationale behind recommended goals, discusses potential risks and benefits of different approaches, and collaboratively develops a plan that is both realistic and aligned with the patient's values. Documentation of this collaborative process is essential for accountability and continuity of care. Question 12. The assessment process reveals that a patient recovering from a stroke has expressed a strong desire to use a newly acquired, advanced communication device that has not yet been fully integrated into the rehabilitation facility's approved technology list and requires further calibration for optimal use with their current functional level. The nurse recognizes the patient's enthusiasm for this device, but also has concerns about its immediate safety and efficacy for independent use in the current rehabilitation phase. What is the most appropriate course of action for the rehabilitation registered nurse? Option A. Collaborate with the patient and the interdisciplinary team to explore the feasibility of integrating the new device, while simultaneously implementing safe and effective alternative communication strategies and developing a phased plan for the advanced device's introduction once fully calibrated and approved. Option B. Immediately implement the patient's preferred advanced communication device, assuming their desire indicates readiness and overriding any concerns about its current calibration and integration status to foster patient satisfaction. Option C. Allow the patient to use the advanced communication device independently as requested, with minimal supervision, to encourage their initiative, despite the known calibration and integration concerns. Option D. Inform the patient that the facility's approved technology list must be strictly adhered to and mandate the use of a standard, pre-approved communication board until the advanced device undergoes a lengthy and uncertain approval process. The correct answer is A. Collaborate with the patient and the interdisciplinary team to explore the feasibility of integrating the new device, while simultaneously implementing safe and effective alternative communication strategies and developing a phased plan for the advanced device's introduction once fully calibrated and approved. Explanation. Scenario analysis. This scenario presents a common challenge in rehabilitation nursing, balancing patient autonomy and safety with the practicalities of implementing assistive technology. The patient's expressed preference for a device that is not yet fully functional or safe for independent use creates a conflict. The rehabilitation nurse must navigate this by ensuring the patient's rights are respected, while upholding the professional responsibility to provide safe and effective care, adhering to established rehabilitation protocols and ethical guidelines. The challenge lies in finding a solution that empowers the patient without compromising their well-being or the integrity of the rehabilitation process. Correct approach analysis. The correct approach prioritizes a collaborative and educational strategy. It involves engaging the patient in understanding the limitations of the current technology, exploring alternative or supplementary assistive devices that are immediately available and safe, and developing a phased implementation plan for the desired technology. This aligns with the ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and respect for autonomy, involving the patient in decision-making. Regulatory frameworks for nursing practice emphasize patient-centered care, evidence-based practice, and the nurse's role in patient education and advocacy. By involving the patient in problem-solving and setting realistic goals, the nurse fosters engagement and promotes a positive therapeutic relationship, ultimately leading to more sustainable and successful rehabilitation outcomes. This approach also respects the nurse's professional judgment regarding the appropriate use of technology in a clinical setting. Incorrect approaches analysis. One incorrect approach involves immediately overriding the patient's preference and mandating the use of a different device without thorough explanation or collaborative problem-solving. This disregards the patient's autonomy and can lead to resentment, decreased motivation, and non-adherence to the rehabilitation plan. It fails to uphold the ethical principle of respect for autonomy and may violate nursing practice standards that require informed consent and patient participation in care planning. Another incorrect approach is to proceed with the implementation of the desired technology despite its known limitations and safety concerns, solely to appease the patient. This directly violates the principle of non-maleficence, as it exposes the patient to potential harm, It also demonstrates a failure to adhere to professional standards of care, which mandate the use of safe and effective interventions. This approach could lead to adverse events and professional repercussions. A third incorrect approach is to dismiss the patient's request outright, without exploring the underlying reasons for their preference or offering any alternatives. This can be perceived as dismissive and unsupportive, damaging the therapeutic alliance and potentially leading the patient to seek solutions outside of the established care plan, which could be unsafe. It fails to demonstrate the empathy and patient advocacy expected of a rehabilitation nurse. Professional reasoning. Professionals should approach such situations by first actively listening to and understanding the patient's perspective and desires. This should be followed by a comprehensive assessment of the patient's needs, capabilities, and the safety and efficacy of available assistive devices. A collaborative discussion should then ensue, where the nurse educates the patient about the pros and cons of different options, including the limitations of the desired technology and the benefits of alternatives. The goal is to co-create a rehabilitation plan that is safe, effective, and aligned with the patient's goals and values, ensuring that all decisions are documented and communicated to the interdisciplinary team. Question 13. Examination of the data shows a rehabilitation patient consistently reports being able to independently perform all activities of daily living during morning interviews. However, during direct observation by nursing staff, the patient demonstrates significant tremor and fatigue when attempting to dress, requiring verbal cues and occasional physical assistance to complete the task. The nurse is documenting the patient's ADL status for the interdisciplinary care plan, which approach best reflects professional best practice in assessing and documenting this patient's ADL status. Option A. Document ADL independence for all ADLs, assuming the patient is motivated to present a positive image. Option B. Document ADL dependence for all ADLs, as the observed difficulties in dressing suggest a generalized decline in functional ability. Option C. Document ADL dependence for dressing, citing observed tremor and fatigue, and noting the discrepancy with self-report. Option D. Document ADL independence based on the patient's consistent self-report, as patient autonomy is paramount. The correct answer is D. Document ADL independence based on the patient's consistent self-report, as patient autonomy is paramount. Explanation. The scenario presents a common challenge in rehabilitation nursing, accurately assessing a patient's functional status for activities of daily living when there are discrepancies between observed performance and self-reported ability. This requires a nuanced approach that prioritizes objective data while acknowledging the patient's subjective experience, all within the framework of patient-centered care and regulatory compliance. The professional challenge lies in balancing the need for accurate documentation for care planning and reimbursement with the ethical imperative to respect patient autonomy and avoid over- or underestimating their capabilities. The correct approach represents best professional practice because it integrates multiple data sources to form a comprehensive understanding of the patient's ADL performance. This aligns with regulatory requirements for thorough patient assessment, which mandate the collection of objective and subjective data to inform individualized care plans. Ethically, this approach respects the patient as the primary source of information about their own experience while validating it with observable evidence, promoting shared decision-making and accurate goal setting. This method ensures that the care plan is tailored to the patient's actual needs and abilities, maximizing their potential for independence and recovery, as expected under standards of care for certified rehabilitation registered nurses. Incorrect approaches fail to meet these standards. One incorrect approach might solely rely on the patient's self-report without objective verification. This is professionally unacceptable, as it can lead to inaccurate care planning, potentially resulting in the patient receiving too much assistance, hindering independence, or too little, risking safety and well-being. It also fails to meet regulatory expectations for objective assessment data. Another incorrect approach might disregard the patient's self-report entirely and rely solely on observation, which can be demoralizing for the patient, undermine their trust, and overlook subtle but significant limitations they experience. This approach can also be incomplete, as some ADL limitations are not readily observable. A third incorrect approach might involve making assumptions based on the patient's diagnosis without a current, individualized assessment, which is a direct violation of the principle of individualized care and can lead to inappropriate interventions and missed opportunities for rehabilitation. The professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and document the patient's self-reported abilities and challenges. Second, conduct direct observation of the patient performing ADLs, noting any discrepancies or difficulties. Third, consider any available collateral information from family or other healthcare professionals. Fourth, synthesize all gathered data to determine the most accurate representation of the patient's functional status. Finally, discuss the findings with the patient, collaboratively developing a care plan that reflects both observed abilities and reported needs, ensuring transparency and patient engagement. Question 14. Performance analysis shows a certified rehabilitation registered nurse, CRRN, is caring for a patient who has expressed a strong preference for a specific, less common physical therapy modality for their post-stroke leg weakness, despite evidence suggesting other modalities are more effective and widely recommended for their condition. The CRRN has reviewed the patient's chart and the current literature. What is the most appropriate course of action for the CRRN in this situation, adhering strictly to U.S. regulatory frameworks and nursing practice guidelines? Option A. Discuss the evidence-based recommendations for effective interventions with the patient, explore the rationale behind their preference, and collaborate with the physical therapist to develop a treatment plan that integrates the patient's goals with evidence-based practice. Option B. Proceed with the physical therapy modality requested by the patient, as patient preference is the primary determinant of care and rehabilitation. Option C. Implement the patient's requested modality without consulting the physical therapist, assuming the patient's request supersedes the need for interdisciplinary input. Option D. Inform the patient that their requested modality is not evidence-based and therefore cannot be provided, without further discussion or exploration of alternatives. The correct answer is A. Discuss the evidence-based recommendations for effective interventions with the patient, explore the rationale behind their preference, and collaborate with the physical therapist to develop a treatment plan that integrates the patient's goals with evidence-based practice. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the Certified Rehabilitation Registered Nurse, CRRN, to balance patient autonomy with the need for evidence-based practice and regulatory compliance in the selection of physical therapy interventions. The patient's preference for a specific modality, even if not the most evidence-based for their condition, creates a conflict that necessitates careful ethical and professional consideration. The CRRN must navigate the patient's right to participate in their care while ensuring that the interventions provided are safe, effective, and aligned with established professional standards and regulatory guidelines for rehabilitation nursing. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing a collaborative and evidence-informed decision-making process. It involves the CRRN engaging in a thorough assessment of the patient's condition, reviewing current evidence for effective interventions, and then discussing these findings with the patient and the physical therapist. This approach respects patient autonomy by involving them in the decision-making process, explaining the rationale behind recommended interventions, and addressing their concerns. It aligns with regulatory frameworks that emphasize patient-centered care, informed consent, and the provision of services that meet professional standards of practice. Specifically, it adheres to guidelines that require nurses to advocate for their patients while ensuring that care is based on the best available evidence and is delivered in a safe and effective manner. Incorrect approaches analysis. An approach that unilaterally dismisses the patient's preference without a thorough discussion and exploration of alternatives fails to uphold the ethical principle of patient autonomy and can lead to patient dissatisfaction and non-adherence. It may also violate regulatory requirements for informed consent and shared decision-making. An approach that solely relies on the patient's stated preference without considering the evidence-based efficacy and safety of the requested intervention neglects the nurse's professional responsibility to provide competent and evidence-based care. This could result in suboptimal outcomes or potential harm, contravening professional standards and potentially regulatory mandates for quality care. An approach that proceeds with an intervention solely based on the patient's request without consulting the physical therapist or considering the broader rehabilitation plan overlooks the interdisciplinary nature of rehabilitation and the importance of a coordinated care approach. This can lead to fragmented care, inefficient resource utilization, and may not align with the overall goals of the rehabilitation program, potentially violating guidelines for interdisciplinary collaboration. Professional reasoning. Professionals should employ a decision-making framework that begins with a comprehensive assessment of the patient's needs and goals. This is followed by an evidence-based review of potential interventions, considering their efficacy, safety, and appropriateness for the patient's specific condition. Crucially, this information must be communicated clearly and empathetically to the patient, fostering a shared decision-making process. The CRRN should then collaborate with the interdisciplinary team, particularly the physical therapist, to develop and implement a plan that integrates patient preferences with evidence-based practice and regulatory requirements. This iterative process ensures that care is patient-centered, effective, and ethically sound. Question 15. The efficiency study reveals that the rehabilitation team's discharge planning process for patients with complex chronic conditions is taking longer than anticipated, impacting bed turnover and resource allocation. A CRRN identifies that a significant factor contributing to the delays is the patient's expressed fear of managing their new medication regimen independently and their limited social support network at home. The CRRN is considering several approaches to address this situation, which approach best aligns with the biopsychosocial model of health and professional nursing practice in this context. Option A. Expedite the discharge process by focusing solely on the medical aspects of care and providing the patient with a standard medication information sheet, assuming they will adapt once at home. Option B. Document the patient's fears and lack of support in the medical record, but proceed with the originally scheduled discharge, as the primary goal is efficient bed turnover. Option C. Schedule a multidisciplinary team meeting to collaboratively reassess the patient's psychosocial barriers to discharge, explore potential solutions such as home health referrals for medication management education and community resource linkage, and revise the discharge plan accordingly. Option D. Delay the discharge unilaterally, citing the patient's psychosocial concerns as the sole reason without further team consultation or patient involvement, to allow for more time to address these issues internally. The correct answer is C. Schedule a multidisciplinary team meeting to collaboratively reassess the patient's psychosocial barriers to discharge, explore potential solutions such as home health referrals for medication management education and community resource linkage, and revise the discharge plan accordingly. Explanation. The efficiency study reveals that the rehabilitation team's discharge planning process for patients with complex chronic conditions is taking longer than anticipated, impacting bed turnover and resource allocation. This scenario is professionally challenging because it pits the need for efficient healthcare delivery against the imperative of providing comprehensive, patient-centered care that addresses the multifaceted needs inherent in the biopsychosocial model of health. Certified Rehabilitation Registered Nurses, CRRN, are tasked with balancing these competing demands while adhering to professional standards and regulatory requirements. The correct approach, which involves a multidisciplinary team meeting to collaboratively reassess the patient's psychosocial barriers to discharge and develop targeted interventions, represents best professional practice. This aligns with the biopsychosocial model by acknowledging that a patient's health status is influenced by biological, psychological, and social factors. Regulatory frameworks for CRRN, such as those outlined by the Rehabilitation Nursing Certification Board, RNCB, and relevant state nurse practice acts, emphasize holistic patient assessment and individualized care planning. Ethically, this approach upholds the principles of beneficence, acting in the patient's best interest, and autonomy, respecting the patient's right to participate in their care decisions, ensuring that discharge planning is not merely a logistical exercise, but a supportive process that promotes successful reintegration into the community. An incorrect approach that focuses solely on expediting the discharge by overlooking the patient's expressed anxieties about returning home and their lack of social support represents a significant regulatory and ethical failure. This approach neglects the psychological and social dimensions of the biopsychosocial model, potentially leading to premature discharge, readmission, and patient distress. It violates the CRRN duty to provide comprehensive care and may contravene regulations requiring adequate patient education and discharge planning that addresses all relevant factors. Another incorrect approach that involves unilaterally deciding to delay discharge without consulting the patient or the interdisciplinary team, citing only the perceived inefficiency of the current process, is also professionally unacceptable. This demonstrates a lack of collaborative practice, a core tenet of rehabilitation nursing. It undermines patient autonomy by making decisions without their input and fails to leverage the expertise of other team members who may have insights into the patient's needs or potential solutions. This can lead to a breakdown in communication and trust, and may not align with facility policies or professional guidelines on interdisciplinary collaboration. A further incorrect approach that involves simply documenting the patient's psychosocial barriers without developing concrete strategies to address them, and then proceeding with discharge as scheduled, is a failure to implement effective nursing interventions. While acknowledging the barriers is a step, failing to act upon them means the patient is being discharged without adequate support, increasing their risk of complications. This is a dereliction of the CRRN responsibility to advocate for the patient and ensure they have the necessary resources for a safe and successful transition. The professional decision-making process for similar situations should involve 1. Recognizing the tension between efficiency and comprehensive care. 2. Actively engaging the patient and family in understanding their perspective and concerns. 3. Convening the interdisciplinary team to share information and brainstorm solutions that address all aspects of the biopsychosocial model. 4. Developing a collaborative, individualized care plan with measurable goals for discharge. 5. Continuously reassessing progress and adapting the plan as needed, ensuring that all decisions are patient-centered and ethically sound, while remaining mindful of regulatory requirements for safe and effective nursing practice. Question 16. Analysis of a postoperative spinal fusion patient's pain presentation in a rehabilitation setting, considering their limited mobility and potential for opioid-induced sedation, requires a nuanced approach to risk assessment. Which of the following strategies best mitigates the risk of inaccurate pain assessment and subsequent suboptimal pain management? Option A. Assuming that postoperative pain will naturally decrease over time and conducting infrequent brief pain assessments. Option B. Employing a combination of a validated numerical rating scale, observation of nonverbal pain indicators, and assessment of functional limitations impacting pain. Option C. Relying exclusively on the patient's verbal report of pain intensity using a 0-10 scale, assuming their cognitive capacity is unimpaired. Option D. Prioritizing the assessment of pain solely through the patient's ability to perform specific therapeutic exercises, without direct pain inquiry. The correct answer is B. Employing a combination of a validated numerical rating scale, observation of nonverbal pain indicators, and assessment of functional limitations impacting pain. Explanation. This scenario is professionally challenging because effective pain assessment in rehabilitation patients is foundational to individualized care planning and achieving optimal functional outcomes. Rehabilitation nurses must navigate the complexities of subjective pain reporting, potential communication barriers, and the impact of pain on a patient's ability to participate in therapy. The nurse's judgment is critical in selecting the most appropriate assessment tool and interpreting the findings within the broader context of the patient's recovery. The correct approach represents best professional practice because it prioritizes a comprehensive, multimodal pain assessment that considers both subjective patient reports and objective observations. This aligns with the ethical imperative to provide patient-centered care and adhere to professional standards of practice, which mandate accurate and thorough assessment as the basis for intervention. Specifically, utilizing a validated pain assessment tool that is appropriate for the patient's cognitive and communication abilities, and corroborating this with observable signs of pain, ensures a more reliable understanding of the patient's pain experience. This approach directly supports the development of an effective, evidence-based pain management plan, which is a core responsibility of a certified rehabilitation registered nurse. An incorrect approach that relies solely on a numerical rating scale without considering nonverbal cues or functional limitations fails to capture the full spectrum of the patient's pain experience. This can lead to underestimation or overestimation of pain, resulting in inadequate pain management and potentially hindering rehabilitation progress. Ethically, this constitutes a failure to provide thorough and individualized care. Another incorrect approach that focuses only on the patient's verbal report of pain, disregarding observable signs of distress or functional impairment, is also professionally unacceptable. This can lead to misinterpretation of the patient's true pain level especially in patients with communication difficulties or cognitive impairments. This approach violates the principle of beneficence by not fully addressing the patient's suffering. A third incorrect approach that assumes pain is an expected and unavoidable part of the rehabilitation process, leading to a less rigorous assessment, is ethically problematic. This demonstrates a lack of patient advocacy and can perpetuate a cycle of undertreated pain, negatively impacting the patient's quality of life and recovery trajectory. It fails to uphold the professional standard of actively seeking to alleviate suffering. The professional decision-making process for similar situations should involve a systematic approach. First, identifying the patient's current status and potential barriers to accurate pain reporting. Second, selecting an appropriate pain assessment tool based on the patient's individual needs and abilities. Third, conducting a thorough assessment that integrates subjective and objective data. And finally, using this comprehensive assessment to inform the development and ongoing evaluation of the pain management plan. This iterative process ensures that care remains responsive to the patient's evolving needs and aligns with best practices in rehabilitation nursing. Question 17. Quality control measures reveal that a rehabilitation registered nurse is caring for a patient who has recently experienced a significant stroke and is demonstrating resistance to participating in physical therapy, stating, "This is pointless. I'm not getting any better, and I don't see the use in continuing." The nurse needs to respond therapeutically. Which of the following approaches best addresses the patient's expressed feelings and facilitates continued engagement in their rehabilitation plan? Option A, don't worry, everything will be fine. You just need to be patient and trust the process. Option B, you need to keep trying. The therapy is essential for your recovery, and you won't improve if you give up. Option C, it sounds like you're feeling overwhelmed and frustrated with the pace of your recovery, and it's understandable to feel that way when progress seems slow. Option D, I understand you feel it's pointless, but the evidence shows that continued therapy is crucial for regaining function. The correct answer is C. It sounds like you're feeling overwhelmed and frustrated with the pace of your recovery, and it's understandable to feel that way when progress seems slow. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the rehabilitation registered nurse to navigate a patient's emotional distress and resistance to care while upholding professional standards of communication and patient advocacy. The patient's expressed frustration and withdrawal create a barrier to effective therapeutic engagement, necessitating a nuanced approach that balances empathy with the need to facilitate progress in rehabilitation. Correct approach analysis. The correct approach demonstrates best professional practice by employing active listening and validation to acknowledge the patient's feelings without necessarily agreeing with the underlying assumptions. This technique, often referred to as reflective listening or empathetic responding, aims to build rapport and trust, making the patient feel heard and understood. By reflecting the patient's expressed emotion, it sounds like you're feeling overwhelmed and frustrated with the pace of your recovery. The nurse opens the door for further dialogue and exploration of the patient's concerns. This aligns with ethical principles of patient-centered care and the professional responsibility to establish a therapeutic alliance, which is crucial for successful rehabilitation outcomes. Regulatory frameworks for nursing practice, such as those governing scope of practice and professional conduct, emphasize the importance of effective communication in patient care. Incorrect approaches analysis. One incorrect approach involves immediately dismissing the patient's feelings and reiterating the importance of the therapy without acknowledging their emotional state. This can be perceived as dismissive and invalidating, potentially increasing the patient's resistance and damaging the therapeutic relationship. Ethically, this fails to uphold the principle of respect for persons and can be seen as a breach of professional conduct by not adequately addressing the patient's psychosocial needs. Another incorrect approach is to engage in excessive reassurance or to offer platitudes like "everything will be fine." While well-intentioned, this can also invalidate the patient's current experience of distress, bypasses the opportunity to explore the root of their frustration, and can lead the patient to feel misunderstood or that their concerns are not being taken seriously. This approach lacks the depth of therapeutic communication required to address complex emotional responses in a rehabilitation setting, and may violate professional standards that mandate empathetic and responsive communication. A third incorrect approach might be to become defensive or to argue with the patient about the necessity of the therapy. This escalates the conflict, erodes trust, and moves away from a therapeutic interaction towards a confrontational one. Professionally, this is unacceptable as it demonstrates a lack of emotional regulation on the part of the nurse and a failure to maintain a professional boundary. It directly contradicts the core tenets of therapeutic communication, which prioritize creating a safe and supportive environment for the patient. Professional reasoning. Professionals should utilize a decision-making framework that prioritizes patient-centered communication. This involves first assessing the patient's emotional state and verbal cues. Then, selecting a therapeutic communication technique that acknowledges and validates these emotions, such as reflective listening or empathetic responding. The goal is to create an environment where the patient feels safe to express their concerns, allowing the nurse to then collaboratively problem solve and address barriers to care. This process requires ongoing assessment, adaptation of communication strategies based on patient response, and adherence to ethical and regulatory guidelines for professional nursing practice. Question 18. Cost-benefit analysis shows that while several occupational therapy interventions could potentially enhance a patient's independence in activities of daily living, the CRRN must recommend the most appropriate course of action. Considering the patient's moderate cognitive impairment and limited upper extremity strength following a stroke, which of the following occupational therapy intervention strategies would represent the most judicious and evidence-based approach for maximizing functional gains while managing resources effectively? Option A. Prioritize adaptive equipment training and task simplification strategies, focusing on compensatory techniques to enable the patient to perform ADLs safely and independently, supported by evidence demonstrating significant functional improvements in individuals with similar cognitive and physical limitations. Option B. Focus primarily on passive range of motion exercises and basic grooming assistance, as these are less resource-intensive, and assume that the patient's cognitive impairment will limit their ability to benefit from more complex or active therapeutic interventions, thereby avoiding potential frustration for both the patient and the therapy team. Option C. Advocate for extensive use of high-cost, technologically advanced assistive devices that offer a wide range of functionalities, assuming that greater technological investment will automatically lead to superior functional outcomes, irrespective of the patient's current cognitive processing abilities or the evidence base for such devices in this specific population. Option D. Recommend a broad spectrum of unproven or experimental therapeutic modalities that are currently under investigation, with the rationale that exploring novel treatments, even without robust evidence of efficacy or cost-effectiveness, might uncover unexpected benefits for the patient. The correct answer is A. Prioritize adaptive equipment training and task simplification strategies, focusing on compensatory techniques to enable the patient to perform ADLs safely and independently, supported by evidence demonstrating significant functional improvements in individuals with similar cognitive and physical limitations. Explanation. This scenario presents a common challenge in rehabilitation nursing, balancing the desire for patient independence with the practicalities of resource allocation and evidence-based practice. The Certified Rehabilitation Registered Nurse, CRRN, must critically evaluate the efficacy and cost-effectiveness of various occupational therapy interventions to ensure the patient receives the most beneficial and appropriate care within the established regulatory framework. The challenge lies in discerning which interventions are truly essential for functional improvement versus those that might be perceived as beneficial, but lack strong evidence or are prohibitively expensive without clear justification. The correct approach prioritizes interventions that are demonstrably effective in improving the patient's functional status, promoting independence, and facilitating safe discharge, aligning with the core principles of rehabilitation nursing and the standards of practice for CRRN. This involves a thorough assessment of the patient's specific needs, goals, and potential for improvement, coupled with an understanding of the evidence supporting different occupational therapy modalities. Adherence to the Nurse Practice Act and facility policies regarding patient care, documentation, and resource utilization is paramount. Ethical considerations, such as patient autonomy and beneficence, also guide the selection of interventions. Incorrect approaches fail to uphold these standards. One incorrect approach might involve recommending interventions solely based on patient preference, without considering their clinical necessity or cost-effectiveness, potentially violating principles of prudent resource management and professional responsibility. Another incorrect approach could be to dismiss interventions that are more costly but have strong evidence of significant functional gains, thereby potentially limiting the patient's recovery potential and contravening the duty to provide optimal care. A third incorrect approach might be to rely on anecdotal evidence or personal opinion rather than established research and clinical guidelines, which is a failure to adhere to evidence-based practice and could lead to suboptimal patient outcomes and potential regulatory scrutiny for providing substandard care. Professional decision-making in such situations requires a systematic process. First, conduct a comprehensive patient assessment to identify specific functional deficits and rehabilitation goals. Second, research and evaluate the evidence base for various occupational therapy interventions relevant to those deficits and goals, considering both efficacy and potential for functional improvement. Third, analyze the cost-benefit of each intervention, factoring in direct costs, staff time, and potential impact on length of stay and discharge readiness. Fourth, collaborate with the interdisciplinary team, including the occupational therapist, to develop a personalized, evidence-based, and cost-effective treatment plan. Finally, document the rationale for all intervention choices clearly and comprehensively, ensuring compliance with all regulatory requirements and ethical obligations. Question 19. Research into rehabilitation nursing practice reveals a patient nearing the end of their inpatient rehabilitation stay for a significant stroke. The patient expresses a strong desire to discontinue occupational therapy sessions, stating they feel tired of it and want to focus solely on physical therapy to regain mobility. The occupational therapist and physical therapist have both noted significant progress in the patient's activities of daily living, adult, and fine motor skills, and believe continued occupational therapy is crucial for maximizing their functional independence at home. The registered nurse is responsible for overseeing the patient's overall care plan and ensuring adherence to rehabilitation goals. What is the most appropriate course of action for the registered nurse in this situation? Option A. Respect the patient's wishes and immediately discontinue all occupational therapy sessions as requested, focusing only on the patient's preferred physical therapy. Option B. Engage in a detailed conversation with the patient to understand their reasons for wanting to discontinue occupational therapy, thoroughly educate them on the benefits of continued occupational therapy for their ADLs and overall independence, and collaboratively discuss their goals and concerns to reach an informed decision. Option C. Immediately inform the patient that their rehabilitation team has determined continued occupational therapy is essential and they must participate as scheduled to achieve optimal outcomes. Option D. Consult with the patient's physician and then relay the physician's directive to the patient that they are required to continue occupational therapy sessions. The correct answer is B. Engage in a detailed conversation with the patient to understand their reasons for wanting to discontinue occupational therapy, thoroughly educate them on the benefits of continued occupational therapy for their ADLs and overall independence, and collaboratively discuss their goals and concerns to reach an informed decision. Explanation. Scenario analysis. This scenario presents a common challenge in rehabilitation nursing where a patient's expressed desire conflicts with the perceived best clinical judgment of the healthcare team. The challenge lies in balancing patient autonomy with the nurse's ethical and professional responsibility to ensure patient safety and promote optimal outcomes. The nurse must navigate the patient's right to self-determination against the potential risks associated with their chosen course of action, all within the established regulatory framework for rehabilitation nursing practice. Correct approach analysis. The correct approach prioritizes open communication, patient education, and collaborative decision-making. By engaging in a detailed discussion about the patient's goals, understanding the rationale behind their request, and thoroughly explaining the potential risks and benefits of both continuing therapy and discontinuing it, the nurse upholds the principle of patient autonomy. This approach aligns with the ethical imperative to respect a patient's right to make informed decisions about their care, even if those decisions differ from the healthcare team's recommendations. Furthermore, it adheres to regulatory guidelines that mandate patient-centered care and shared decision-making, ensuring the patient is an active participant in their treatment plan. Documenting this comprehensive discussion and the patient's informed decision is crucial for legal and professional accountability. Incorrect approaches analysis. One incorrect approach involves immediately acceding to the patient's request without further exploration. This fails to uphold the nurse's professional responsibility to ensure the patient is making an informed decision. It bypasses the crucial step of educating the patient about the potential consequences of discontinuing therapy, thereby violating the ethical principle of beneficence, acting in the patient's best interest, and potentially leading to suboptimal rehabilitation outcomes. This approach also neglects the regulatory requirement for comprehensive patient assessment and education. Another incorrect approach is to dismiss the patient's request outright and insist on continuing therapy against their wishes. This directly violates the principle of patient autonomy and can lead to a breakdown in the therapeutic relationship. It positions the nurse as authoritarian rather than a collaborative partner, undermining trust and potentially causing the patient to disengage from their rehabilitation. This approach disregards the patient's right to self-determination, a cornerstone of ethical healthcare practice and a key regulatory expectation. A third incorrect approach involves consulting with the physician and then informing the patient that the physician has decided they must continue therapy. While physician input is valuable, this approach centralizes decision-making with the physician and removes the patient from the core of the decision-making process. It fails to empower the patient and can be perceived as paternalistic, neglecting the collaborative nature of care planning that is expected in rehabilitation nursing. The patient's voice and understanding are diminished in this model. Professional reasoning. When faced with a patient's request that deviates from the established plan, a rehabilitation nurse should employ a structured decision-making process. First, actively listen to and validate the patient's concerns and desires. Second, conduct a thorough assessment to understand the underlying reasons for the request and any potential contributing factors. Third, provide clear, unbiased education regarding the benefits and risks of all available options, including continuing and discontinuing therapy, tailored to the patient's comprehension level. Fourth, engage in a collaborative discussion to explore alternatives and potential compromises. Fifth, document the entire process, including the patient's understanding, their decision, and the rationale behind it, ensuring all actions are aligned with ethical principles and regulatory mandates for patient-centered care and informed consent. Question 20. The monitoring system demonstrates a patient experiencing persistent moderate pain despite a prescribed regimen of scheduled acetaminophen and as-needed opioid analgesics. The patient reports limited improvement in their ability to participate in physical therapy sessions due to this pain. Which of the following strategies best aligns with current regulatory frameworks for pain management in rehabilitation? Option A. Implement a multimodal pain management approach including non-pharmacological interventions and reassess the effectiveness of the current pharmacological regimen. Option B. Increase the dosage of the as-needed opioid analgesic and continue the scheduled acetaminophen. Option C. Discontinue the scheduled acetaminophen and increase the frequency of the as-needed opioid analgesic. Option D. Advise the patient to rest and avoid physical therapy until their pain subsides completely. The correct answer is B. Increase the dosage of the as-needed opioid analgesic and continue the scheduled acetaminophen. Explanation. This scenario is professionally challenging because it requires the rehabilitation registered nurse to balance the patient's immediate need for pain relief with the long-term goal of functional recovery, all while adhering to established regulatory guidelines for pain management and patient safety. The nurse must critically evaluate the effectiveness and appropriateness of various pain management strategies, considering potential side effects, patient response, and the risk of developing dependence or tolerance. Careful judgment is required to select and implement interventions that are evidence-based and tailored to the individual patient's needs and rehabilitation goals. The correct approach represents best professional practice because it prioritizes a comprehensive, multimodal, and individualized pain management plan. This aligns with regulatory frameworks that emphasize patient-centered care, evidence-based practice, and the prevention of adverse events. Specifically, it reflects adherence to guidelines that advocate for a holistic assessment of pain, the use of non-pharmacological interventions alongside pharmacological ones, regular reassessment of pain and treatment effectiveness, and patient education regarding pain management. This approach ensures that pain is managed effectively without compromising the rehabilitation process or patient safety, thereby upholding the nurse's ethical and professional responsibilities. An incorrect approach that relies solely on escalating opioid dosages without exploring non-pharmacological options or reassessing the underlying cause of persistent pain represents a failure to adhere to best practices and potentially regulatory guidelines. Such an approach could lead to increased risk of opioid-induced side effects, tolerance, and dependence, which are contrary to safe and effective pain management principles. May also indicate a lack of thorough patient assessment and a failure to consider the broader rehabilitation goals. Another incorrect approach, such as discontinuing all pain medication abruptly due to concerns about dependence without a proper tapering plan or alternative pain relief strategies, could lead to severe withdrawal symptoms and uncontrolled pain, hindering the rehabilitation process. This demonstrates a lack of understanding of pharmacologic principles and patient safety protocols. Finally, an approach that neglects to document the patient's pain levels, interventions, and response to treatment is a direct violation of professional documentation standards and regulatory requirements. Inadequate documentation can impede continuity of care, prevent effective evaluation of treatment efficacy, and create legal and ethical liabilities. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly assess the patient's pain, including its intensity, location, quality, and impact on function. 2. Identify contributing factors to the pain, considering both physical and psychosocial elements. 3. Develop a collaborative, individualized pain management plan that incorporates pharmacological and non-pharmacological interventions, aligned with evidence-based guidelines. 4. Regularly monitor and reassess the patient's pain in response to interventions, adjusting the plan as needed. 5. Educate the patient and their family about the pain management plan, potential side effects, and self-management strategies. 6. Document all assessments, interventions, and patient responses meticulously.